Folks, thanks for joining us today. My name's John Dubas with Premier Marketing, and we'll be spending some time today discussing keys to help maximize your Medicare supplement sales. A mouthful there, but what does that mean? We're going to go through some different things as to why someone would need a Medicare supplement plan, give you some detail as to what may best fit that individual when it comes to plan type and carrier, which is important for you as well. And of course, then also go through some of the support systems that we have in play to help not only get you in front of folks for these presentations, but also help you sell while you are there. Today's presentation is being recorded and will be made available on our website at premiersmi.com and on our YouTube channel as well. And additionally, the agent success manager, the marketer with whom you deal with within Premier, will have the information for you as well. If you are new to us and don't have someone, we'll make certain that we have a point of contact and a subject matter expert made available to you. You'll notice in the software package that there's a section for both questions and chat. We ask that you put your questions in the questions box. We find that we address most of them through the course of the presentation normally, but we want to make certain that we get you any sort of information that you require in order to maximize the return of the investment that you're putting into today's presentation, listening with us and spending your most valuable resource, which is your time. For some agents, some of this might be a review. For some, it may be brand new to them. We're addressing agents with varying amount of experience, and we hope that we lend value regardless of your experience in this area. We want to make certain that you, however, recognize some of the things that might be, if you are an experienced agent, something that worked so very well in the past, and then all of a sudden we quit doing it. One of the things that we'll do to start then is give you kind of a level set as to who Premier is. Different folks have different experiences with us, and we want to make certain that you realize we are a national marketing organization founded in 1968. That's part of the Integrity Marketing Platform. We're licensed in all 50 states, acting as an insurance wholesaler through independent insurance agents such as yourself. And we do so through contracts that are at the highest possible commission levels, with recruiting contracts available to those who qualify. We work with a portfolio of products aimed at our key demographic. So that includes the base Medicare programs, the Medicare Advantage and Medicare Supplement plans, the Part D prescription drug programs to make certain we have the medical coverages for the Medicare population. But we also offer a portfolio of life insurance and annuity products, including final expense life insurance and pre-need plans. Also, an offering of long and short-term care programs, in addition to disability income plans and ancillary benefits that can be of value to folks with specific needs. And this is an area that we see many agents utilize when they offer Medicare supplement plans, because much as the Medicare Advantage plans may have some of these benefits embedded into their program, generally the Medicare supplement plans do not. When we speak of those Medicare Advantage plans, those national carriers are there for you for your use through our organization, along with many of the strong regional carriers that can make a difference for you in your key market. And that same philosophy carries over into the prescription drug plans. A lot of it, well, gee, that's the way it is, because much of these contracts are part of the MA program contract that you may have in play. A couple of exceptions. Mutual of Omaha is separate from any of their other offerings. It's a different contract. And Clever RX is actually a discount program, not a Part D prescription drug plan. Medicare supplements. So when we look at the selections that are available to you, this is one of the key points we discussed today, and I'll show you in detail in just a bit as to what carriers do you need as part of your portfolio. Keep in mind, this is a fluid situation, and we will see some price differentials change over time. However, there's consistencies that we can chart and look at to help us understand, boy, I need this in my market. This is a hot program in my market. And we have systems that can help you identify that. So a great way to make certain that the Medicare supplement arena is serviced by you and done so with full program support. When you look at those ancillary benefits that I alluded to a little bit earlier in each of the categories, you got the national leaders. And these can be key components for you when you pursue the Medicare market for a number of reasons. One, oversight's different. Compliance is different. Many times when you work the Medicare arena, even if it's Medicare supplements, you need to look at, are there documents I need in play in order to be able to present things compliantly? Yeah, I know Medicare supplements do not require a scope of appointment, but generally they bring about questions on programs that do. So you talk about Medicare supplement plans, you're going to talk about the Part D programs. That scope of appointment that you lay out for those programs speaks to and opens the door for discussion on ancillary products. And you can work it backwards as well, utilizing these as the door opener to visit about the other programs that you are offering. Big difference. It gives you that marketing flexibility. It also gives you, well, gee, in all honesty, another revenue stream for yourself and for your agency, but it also satisfies the needs of our prospects and clients in different areas. We look at the Medicare market overall, it's a big market. Everybody's aware of that. You hear of the aging of the baby boomers, the silver tsunami, one every 10 seconds, 10,000 plus a day, and you see it's near exponential growth. However, we are discovering, and research backs it up, that there are a number of folks that become eligible for Medicare and don't take advantage of all of their benefits for one reason or another. They may defer Part B and access to the other Medicare benefits because, hey, I'm still working. I got coverage at work. I'm going to do so because I'm one of the tail end baby boomers and I don't get full Social Security until the age of 65. So that whittles that number down just a little bit, but it's more than made up for by the folks that are under the age of 65 accessing Medicare benefits because of a disability. A unique group for us as we pursue Medicare supplement business because their choices may well be limited in most states. However, in each of these categories, we want to make certain that this huge market is available to us and we can service it through the programs that we offer, because we need to communicate properly with the individuals as well. This is a screenshot from the CMS website, and it speaks to the acronyms, the language that is part and parcel of our industry. 4,420 of them. Good golly, Ms. Molly. We want to make certain that we are aware of what the acronyms mean ourselves. We're able to communicate that and visit with our prospects and clients because of that. But it also gives us a reminder of, well, gee, define it. And if you can, limit your use of acronyms so we communicate effectively with the audience that we are presenting these programs to. Year round, well, you know, Medicare supplement plans are not subject to lock-in in most cases. You have underwriting in a lot of states, but it isn't the same as an MA plan where there are certain enrollment periods or special election periods. However, we're finding, and it's backed up by Kaiser Family Foundation and others that do research in this area, that the majority of people that are on Medicare aren't doing an annual review. And for those of you that have been active in this area for a little bit of time, you can understand that that may well be a big problem because benefits change on the Medicare Advantage plans. They change on the Medicare prescription drug programs. The benefits on a Medicare supplement plan remain constant according to plan type. However, they also can vary because of the premiums that are associated with them, I should say. So this gives us an opportunity to reach out to people year round because, hey, the majority of them need our help year round. And even though the percentages vary just a little bit because of the base coverages, where you see a greater number of people that are on an MA plan become comfortable with it and don't do a review, shame on them, could cost them big money. We look at the PDP programs and we see that, gee, this is something we're working with generally on a presentation to an individual with Medicare supplement coverage. The majority of them aren't doing a year-over-year review either. So we have the opportunity to offer our services, particularly in light of a couple of tools I'm going to show you in just a little bit, that can make a difference as to why they want to talk to us. Well, they're not using the information the government puts out there. They're not even fully vesting themselves into the reading and study of the Medicare U-book they get electronically or through snail mail. They're not using some of the electronic means or other recordings that are out there. So we want to make certain that we are able to deliver information to them that can make a difference, can nudge them off the snide. Hey, this is going to save you this amount of money, same coverage, whatever it is. We have our ways of delivering that information, and some of the tools we'll discuss in just a little bit give us the opportunity to quote in person, deliver information virtually, and work in that hybrid situation as well, should the opportunity arise for us to take advantage of a closing tool that helps us if we don't have a one-call close. So some different things then when we're delivering information that is welcomed by the population, because hey, over the last few years when the pandemic hit, we're becoming increasingly digitally savvy, says the seniors. And that is because, well, gee, they're being trained by their doctors, their specialists. They're doing a lot of prelim work for hospitals and dentists even, and it affects other portions of their life, their celebration of faith. Much of what we do nowadays is all virtually done. And so the population we serve in this area is becoming more adept at receiving that information, assimilating it, and acting upon it, which is a big deal for us as agents because it can really help us with time management, making certain we're compliant with the information we deliver, and as importantly, gives us the opportunity to become that individual's agent. So we look at these election periods. Well, gee, through the end of March, we still deal with, for the next week or so, at the time of this recording, the OEP period, where people that are on a Medicare Advantage plan have the opportunity to go back to traditional Medicare and pick up a drug program, which generally means they need help with other coverage. That is an opportunity we have through the end of the month. We do also have the opportunity to work with folks that may qualify for one of the special election periods that appear pretty standard year over year. Some of these deal with income and assets, so that might be a challenge for what we're doing here, but it also gives us the opportunity for, if someone wants to change MA coverage, well, and that's in their best interest, we can still do that as an agent offering many programs, but it gives us then the opportunity also to address their needs should they be locked in, and we're trying to make certain that they get locked out, in a manner of speaking. So this gives us the opportunity to help people in those big percentages that we looked at just a little bit. And hey, there's even special election periods brought about by weather and other circumstances, and carriers are really good about keeping us abreast of some of those special election periods. So let's look at some different keys that we can use to maximize your MedSup sales, and look at it from a base reasoning as to why does someone need to pay for another policy when I've got Medicare? You know, we've got a plethora of commercials on television. They speak to a whole bunch of things. Some of them are helping my receding hairline work much more quickly in that area, but you do have one that rings a bell that says, hey, we've got Medicare, why do we need anything else? Well, that's the joy of these, without looking to offend anyone, the Medicare Bible, the Medicare and You book that goes through and speaks to the base coverages and the options that someone have when they are on Medicare. So we want to make certain that the needs that they have are covered. So that includes a hospital stay. How are we going to cover that? It includes a time period with a deductible and coinsurance without a maximum out of pocket. How does the Medicare supplement plan cover those expenses? Same thing. How does it do it on the Part B, which is a lot of times we think of that as the coverage for medical for the doctors. So in those circumstances, what we're looking at is a need for a program that's going to take care of that financial shortfall that we see in traditional Medicare. It also then gives us the opportunity, much as what I visited with you a bit ago about using the scope of appointment to open a door for discussion. Well, this does too, because it has that information as to what's not covered by Part A or Part B of Medicare. And keep in mind, for the vast majority of cases, the only way that a Medicare supplement plan will pay is if Medicare is covering it as well. And sometimes we overlook that. So that gives us the impetus to speak to exactly that. It's got to be a covered expense by Medicare for it to be covered by a medical coverage through a Medicare supplement plan, but it then also gives us the opportunity to speak to other coverages that are generally demand products. This gives us the opportunity then to look at and address the different choices that an individual has. They, of course, can bundle their benefits in the Part C programs, the Medicare Advantage plans, the all-in-one plans that are being trumpeted to death on TV commercials. But a person coming on to Medicare, they don't have to do anything. They can even decline to Part B. And some are, as we mentioned earlier, that are working past the age of 65 or for whatever other reason. Generally, however, folks on traditional Medicare, if they're not looking for other coverage, they're going to self-insure for those shortfalls that we just spoke of, the Part A and Part B deductibles and coinsurance. They may pick up a Part D plan to help them with their medications, but many of them look at the standardized, modernized Medicare supplement plans to take care of what Medicare doesn't when it comes to medical expenses. They still need to pick up a Part D plan because the Medigap programs, the MedSup programs, do not have integrated drug benefits for prescription medications. They help with the Part B medications, of course. But that is why many folks that are considering themselves as a Medicare supplement agent will go through some annual certification with the Medicare Advantage carriers to make certain that they're not giving away business for the Part D programs. Some of you may be thinking, well, gee, John, commissions aren't big on that, on a single case. And they're not huge, but it is a expression of the old saying, the adage from Confucius, that many pebbles build a great wall. And that annual review that you do with that gives you the opportunity to make certain that individual, your client, remains speaking to you. So we're looking to drive persistency, retention through some of the choices that we have on the choices that people have for additional coverage on their base medical coverage. We look at the differentiation between the choices a person has when they're first coming into Medicare. Now, I'm not talking just T65s. I'm talking about some of the what we refer to as the late to Medicare seniors, that percentage that work past the age of 65. In the past, it was fairly an even split as to the base medical coverages between Medicare Advantage and MedSup from an older study from DEFT. But as we see some of the things that are going on now post-pandemic, we're seeing a bit of a switch there, where there's an emphasis on Medicare Advantage plans for many of these folks for one reason or another, but the MedSup market is still very viable and still an area where you need to have it if you're working with the Medicare population. And for many folks, if you're looking for a higher income individual, it's got a logic that comes with it. So we got to remember, however, that if we work, as I mentioned before, Medicare supplements, we also make arrangements for coverage or at least information on the Part D plans. We see many agents that will look at this and go, I'm not doing that. I'm not doing it year over year. I'm just going to send them to the Medicare.gov website with information and they can enroll themselves. They can. You're giving up a little bit of commission, but you're also giving up a little bit of control of your prospecting client. And we want to make certain that as they do business in other areas, it's with you, it's with us. So covering our bases can make that difference come into play because, hey, one size doesn't fit all. We want to do those annual reviews. We want to make certain that they understand the differences between MedSup and Medicare Advantage plans. I'm not sitting here telling you that one is better than the other. I don't think there's a magic bullet for anything in our lives. But for some folks, the choice is evident to them as they go through and they look at different pieces of information. So we want to be aware of the differences between a Medicare supplement and a Medicare Advantage plan, not to bum wrap one or the other, but to make certain that we are providing options for folks. They're making a discovery of the differences, and they are also then, well, they're looking at what is the best coverage for them in their mind. We want to be able to deliver on that information and help them with those programs that are available. So as we look at some of these, why do you want to offer one or the other or both? Well, keep in mind, if you're offering Medicare Advantage programs, you're going to go through an annual certification. Same thing with the Part D prescription drug programs. These coverages are subject to change. So unlike a Plan G being a Plan G being a Plan G, regardless of the carrier, well, a Medicare Advantage plan in the market can be vastly different than another one in the same zip code. There are also different things we can do to market a MedSup that we cannot do with a Medicare Advantage plan. Still have a number of agents that have a relationship with Ma Bell, and they smile and dial for Medicare supplements. You can do that with Medicare supplements. You can't with MA or PDP plans, no matter what some of the offshore call centers are doing, like the 3 that I've received this morning specifically on that topic. So you have different compliance oversight there as well. So as I mentioned, the scope of appointment as an example for a compliance piece is required for MA and PDP plans, not for MedSup. However, you get in this discussion with many of the folks, unless you're just quoting premium on a MedSup, they're going to ask about some of these other coverages. And as I mentioned, it gives you then the opportunity to stay compliant and use that scope of appointment as a door opener for other coverages. You also see some differences in compensation, obviously. The max compensation for Medicare Advantage and PDP programs is set by the government. Generally goes up a COLA of a little bit each and every year, as do your renewals. Most of the plans then pay a lifetime renewal on the commissions within the Medicare Advantage arena, but that max is set. With Medicare supplement plans, well, it's a percentage of premium generally what you pay or what you are paid as a commission, but it also, well, you will see different incentive programs put out by the different carriers that can affect the monies that are available to you as a conscientious agent offering Medicare supplement plans. So a bit of a difference there too. Plus you can see the standard feet on the street agent contract for MA pays the same generally no matter what the carrier is. They're all pushing top dollar. With MedSups, it's a percentage, and that percentage paid can vary from carrier to carrier. We also want to make certain that we realize that contracting can be handled a little more quickly on a MedSup than it can a PDP plan, simply because no certification is required on a Medicare supplement plan, except for one carrier. So it can be done much more quickly. And of course, then we have to deal with the differences in underwriting. Where Medicare Advantage plans, well, they basically have to take everyone. So it's not a medically underwritten program, where Medicare supplement plans, particularly in the lock-in period, in most states are underwritten. There are exceptions, and that can make a difference for you as to what may be the best option for your prospecting client moving forward. A big thing here too, well, our audience, as we reach out to them, as we temper our marketing activity, we want to make certain that we look at the demographics that can maximize our return on a lead. So the lower income folks, they may want a MedSup, but they can't afford it. In the old days, in another lifetime, a manager of mine used to say, you know, what's the best kind of life insurance? It's one that's in force when you need it. And that's what we see with Medicare Advantage and Medicare supplement plans. In many circumstances, they can't afford the premium and the coverage goes away. Well, you got a challenge there. So that's something to consider as we pursue this population as to Well, we don't necessarily want to appeal to the lower income individuals unless we have Medicare Advantage plans as part of our portfolio. It's also important to note that where you are marketing can make a difference. The more urban areas, well, you've got a lot more play with the Medicare Advantage plans because you got more competition with different carriers doing that. And generally in the past, we didn't see a lot of choices for folks that are in a more rural area. And in some areas, that's still the choice. So that might be one of the things that we see when we pursue business in a more rural setting, something to consider. We also want to make certain that we realize that there are certain plans we can offer people in the Medicare population that we can't with others. What do you mean by that, John? Well, there's that lovely little piece of legislation that came through effective the 1st of January of 2020 that says folks that had Medicare before that, well, they can still get a C or an F plan. If they got Medicare after 1/1/2020, not so much. You can't offer those programs. You do, however, as you market and you run across individuals that are, let's say, 69 years old. They have an F plan. Premium's gone up. You can quote them. You can do some different things to help ease that financial obligation in many circumstances, and they can change from one F plan to another because they are in a different group than the younger population. So we want to make certain that we are cognitive of that fact as well. So if you're pursuing a T65 individual, you're not quoting them Plan F unless they are coming off of medical disability, aging into Medicare, and they had medical coverage prior with Medicare to 1/1/2020. We also want to make certain that the standardization of Medicare supplement plans, we realize in certain markets, well, they're a little bit different. You look at Massachusetts, Minnesota, and Wisconsin, Medigap policies are standardized in a different way than they are in other parts of the country. It's also important to note that when a carrier comes into your market, they don't have to offer every plan type to everyone. If they are offering any type of Medigap policy, however, they have to offer the Plan A, which is generally the program that's available to the folks that are on Medicare because of disability. And they have to offer the full coverage programs if they offer any other plan as well. Even if we're looking at an individual that is younger than that, we want to make certain that we understand what programs are available to them. Gee, I must have had fun typing this. There are particular areas of the country as well, different states that may have a birthday month opportunity for a person to change coverage without underwriting, or an anniversary month of the policy purchase. That's what those colons, semicolons are. Those are P's in my world, I guess. Well, that gives them an opportunity to change coverage as well. It's important to note that some of that may affect your commission. So we want to make certain that we are able to deliver upon that. You do also have a couple of different things that can not only affect the enrollment, but your commission. And that includes the open enrollment period, which is a one-time only 6-month period where federal law allows you to buy any Medigap policy you want that's sold in the state. It starts the first month in which you're covered under Medicare Part B, and if you're 65 or older. In this period, you can't be denied that Medigap policy or be charged more due to past or present health problems. Some states may have additional open enrollment rights under state law, and we saw that in a wee bit there earlier. The guarantee issue programs, these are rights you have in certain circumstances as a Medicare beneficiary that enables you that if you lose other health coverage, you have an opportunity to pick up coverage that you wouldn't in other areas or in other circumstances without underwriting. So this is a way then during a specific time period where the insurance company cannot deny an individual that policy or place conditions on that policy, such as exclusions for pre-existing conditions or layout period, or charge you more. So that's important for us to note and be aware of those specific circumstances in our target state, because they can vary from state to state. We're also making certain that we realize that there are some policies that have been popular in the past that we may not see as often, and these are the Medicare Select programs. These are Medicare supplement programs that basically, for a planned procedure, they have a hospital partner. It's important to note that if someone takes that out and that relationship between that carrier and that hospital changes, well, obviously, we've got to do something to protect the population. And that person, if they do take out a Medicare supplement plan, they have a right to change their mind within the first year and switch to a standard Medigap policy. Don't see those in many markets anymore, but it's something to be aware of. These are some things that I mentioned a bit earlier as the states with specific circumstances. And these are states that have additional Medigap open enrollment windows, the rules varying by state. So if you're looking at Nevada, California, Oregon, Washington, Idaho, Illinois, Missouri, New York, Connecticut, Vermont, and Maine, we want you to be aware of the fact that there are different rules that may come into play in this circumstance, where you have birthday rules, where during the month of the birth of the individual, they can change without underwriting. Some have an open enrollment all the time. You see that on the East Coast. And then, of course, in the sovereign state of Missouri, you got the anniversary rule, where the anniversary of the issuance of that policy, it gives that individual the opportunity to enroll in another program without medical underwriting. Something important. And that can make a difference for folks that are marketing in multiple states. We want to make certain, too, that we realize that folks have different reasons for wanting to change Medigap policies. They may be mad at their agent, and that might be something. But for some folks, they feel that they might be paying for more benefits that they don't need. Don't run across this too much. Everybody wants as much as they can get. And sometimes the premium difference between the plan choices, well, it talks them out of that particular change. But it may be a circumstance where they took out a less expensive plan earlier, need additional benefits with a plan that's more all-inclusive moving forward. So that's something to consider. It's also a opportunity for folks that, well, gee, they want to change carriers. They for one reason, they've had a bad experience with a carrier, and they don't want to do business with them anymore. And so that's one reason why people will change as well, including folks that, well, the most common reason is they're shopping the policy because it's had a price increase and they're looking for something a wee bit less expensive. So do we have then tools that give us answers in each of these areas? And I'll show you that you have a program that can really help you in that area. It's also important to note that folks on it with a MedSup, they do have that 30-day free look period where they can take out a program and decide later on, buyer's remorse, I don't want to change. And there they go. So some things that can come into play to put the program in play as well. Let's look at some of the data on this. We look at the number of folks that are Medicare supplement policyholders. To quote, paraphrase, I should say, Mark Twain, the news of my death is greatly exaggerated. Well, MedSups have a place in this world, most certainly, and are continually growing in the policy numbers that are available or are out there. Keep in mind, the Medicare pool is growing as well. So we're seeing a growth throughout the options that they have. But someone says, well, gee, you got to get on that Medicare Advantage train and then you got to ride that pony. Mixed a couple of analogies there, sorry. Well, not in all circumstances. We still want to make certain that we have that portfolio of programs that can make a difference. It's also important to note, too, that when we look at an individual, we talked about, can they afford it? So let's look at some of the circumstances that come into play for folks that are off of the federal poverty level. And when you get into the folks that are of greater financial risk or need, that's a great appeal by many of the Medicare Advantage programs. So we're looking at here a prospect that may be mid to higher range in the Medicare community. And for us as agents, that gives us then the opportunity to sell additional programs because they have the funds to do so. We also want to look at age. If they're under the age of 65, one, they're hard to find, but two, generally they're offered a plan A. It's expensive. They don't get a lot of benefits. You'll see a number of folks when they first come on Medicare. That's where a whole bunch of folk are in the age demographic. Over 52% of them in that 10-year period, basically. We see drop off in the subsequent years for could be a multitude of reasons. One, sometimes that folks won't change when they get much older. They become comfortable no matter what you say, but also they may be running out of funds to pay that premium. Remember that statement earlier of, well, gee, we want to make certain that the policy is in place when they need it. And that may be one of the reasons why an older individual is not as prevalent in the Medicare supplement community. Could also be the fact that there aren't as many of them too, but keep in mind, maybe financial. We also want to make certain that folks realize now that as they age into Medicare, remember that slide previous, the Plan F was the plan of choice until 1/1 of 2020 across the board. For folks that are older than that, still is. But right now, the most popular plan being offered to the community is a Plan G. You'll see a lot of activity with a Plan N as well, but generally, that's what we're seeing across the board and the information that's delivered to us by different organizations that give us the detail. You also see a number of different carriers in play that dominate the market. So if you look at this particular slide, you're looking at, well, gee, let's take a peeky here. United Healthcare with their ERP product has basically a third of the market. CVS and Aetna have almost as many as well. Mutual of Omaha and the Wild Kingdom, they got 10% of the market. Anthem and their different affiliates have a good chunk of it. And then of course, HCSC, that's a Blue Cross Blue Shield program in 5 states, and it can make a difference. You see Cigna and Humana. Once we go below that, what we see in many of these circumstances is a number of carriers chasing that business. And we will see too then that many of these carriers will pursue it vehemently based on price. So some things we will look at in just a little bit as to how we determine what pony we ride there too. Once again, this is just detail as to what plan types are there. Many agents, as they're active in this area, are aware of those differences, and they basically beat the drum on one of them. However, knowing the difference between the plan types and how it can affect that individual's coverage makes a big difference. So let's look at some of the choices that we have when it comes to the tools that we have available. Sorry, you don't want my email. We want this. As we utilize Medicare Center, one of the quoting tools that are in there is powered by CSG, and it gives us the opportunity to do a whole bunch of, well, homework for one thing, but also a way of offering a complimentary Medicare supplement review. It gives us then the opportunity to go in there and visit with individuals with specifics to their situation. Now, keep in mind, this tool is available to agents that contract with our organization without any cost. And CSG's quoting engine is the beast in the market in our industry. It is the tool most commonly used by folks when they're doing Medicare supplement comparisons. Now, you got quoting tools with the carriers as well that can make a difference. But as we come into this system, log into it, we have a number of opportunities to visit on different topics. So this is an area where we can have that scope and store it for that 10-year period. We can do different things when it comes to prescription drug plans if we've done our base coverages within ourselves to remain compliant. But hey, this is where we quote the Medicare supplement plans. So it gives us an opportunity then to go in and detail things for our prospecting client. So let's do some different things here and create someone. Let's look at this. And we're going to look at this so we can offer a plan F. So let's look at an individual that's a little older than our T65. Let's say here. So we're looking at a 69-year-old female who is not a partaker of tobacco. We're sorting these quotes by price. We're offering information at this time on a plan G. We're looking at an effective date. Normally, they're put the first of the, pardon me, come on here, first of the month. And that's important too, because sometimes the pricing of these programs may change at the first of a month too. We're not applying a household discount, but this can make a big difference when you're visiting with an individual and it's a hubby and wife situation. Because these discounts together not only give you an opportunity to speak to more than one individual about their coverage, but it affects their cost greatly. So all that great detail that I just went through there, we hit one button and you hear the Jeopardy theme going through your head. It's looking at and drawing the information we need for a female age 69 in Lewisville, Texas. It then gives us that detail on the vast majority of plans that are out there in this area. It gives us then a sorting by dollars in this circumstance, because you can sort by whatever. Oops. It's going to tell you too what e-apps are available here, which is a great piece. Look at this. Bear with me a moment. Come on. So you can quote and price it out by ratings, company name, or price. Most commonly, we lay it out with price. It then gives us information on these different carriers as to, while we're quoting an individual, do they have a household discount? Do they have a policy fee? And let's expand some different things here too then. Whoops. That wasn't what I wanted to do. We want to do a little bit of market analytics. It's going to tell us some different things that come into play. And this is important information for us as agents, because it then helps us set up expectations with that individual. They're going to have price increases with med subs. It's the way it is. With the medical trend being the way it is, companies do have to garner the necessary premium to cover the cost of the claims. But we can see what those price increases are by age. Those are set. And if there's been any history of a price increase in the past. Now keep in mind, this is the old National General. The All-State program hasn't been in the market long enough to make a difference when it comes to price increase year over year. It does, however, also give us some data here with the markets. And let's look at that when we look at some of the other carriers. And we see the different carriers that are battling because of price or with price, and how that makes a difference. We'll see too then that, well, gee, in this circumstance, we got a carrier that's very price effective or price competitive, very low increases until this last year where we saw one. Book was getting older. We can then look at too how that can affect the choices that an individual has when it comes to a Medicare supplement plan, because it's not just what they're being charged now. Many of them don't want to change year over year when it comes to their coverage. Offering a program that has steady premiums can make a difference. You still touch base with them, but you don't have to rewrite the plan all the bloody time. So we want to make certain that we're positively affecting the coverages that they have and our ability to maintain that individual as a client. So we look at some of these and we go through them. Well, we got to the duck here, but we don't normally think of that program as a med sup plan. It is. But you're seeing some of the programs that are, well, for want of a better term, less of a name program until we hit the biggie boy here. And I want to show this simply because, well, you've got some different pieces that come into play. but you have a strong, steady influence when it comes to the price increases. And part of that may well be due to the fact that, gee, that's a huge book of business. That's a huge book of business, even in the state of Texas. You see a moderate loss ratio. Anything under 80 or 82% can make a big difference. You can see how it dominates the market across the country, not so much in Texas, but the difference is that they have in that premium. And that gives that organization an opportunity to absorb different price or payouts that they have and not necessarily push up a price increase on a constant basis. They're going to go up too. But you will also see then in the state of Texas, Blue Cross Blue Shield's a name brand. You have folks that say, hey, that's what I had when I was young. That's what I had when I was working. That's what I want as I age and have medical coverage. And you see then some folks that will look for a brand, and with that brand, a steady, minimized, increased history that they have in play. So we look at this and, gee, that's a big book as well. Not in the range of that United Healthcare ERP piece. That's still a big book. And that's one of the reasons why they can absorb claims better than some of the others. And that's a big differentiator for us, particularly if we go through and explain the differences. We can, of course, can download this information a couple of different ways. If we do it in the form of a PDF, this is going to show just the Plan G for these programs that we're seeing here on the screen. And I'll think about it for a little bit because it's got a lot of data that it pulls into that particular piece. But one of the things you have with a PDF, unless they got an Adobe program that can break it, that's what you quote. They know that's what they're getting. There's elimination of ambiguity in those circumstances. You also then have an opportunity to do something different as well, and that's download information for you that goes into different plan types. And let's take a peek at that as soon as it can pull up, because this is a very valuable tool for you in your portfolio that you have and the offerings that bring about why you're recommending one plan over the other. There we go. So one of the things this does, and I wanted to show you this, and I'm trying to speed up because I'm going a little longer than I anticipated. So what we're seeing here then is the spread across the board. This is listing all the carriers offering a program in that area by plan type. So if we're talking about under 65 people in the ages in the state of Texas, well, gee, they've only got the Plan A with most of the carriers as an option for them. It gives them then also the rates that come into play, but then it can tell you, well, gee, what about a Plan C? Well, there you go. That's what's available in that area for a Plan C. It also gives you then the opportunity to go through and look at all these different plan types. So this is a great piece for you to have in your files, electronically or however you keep them, that gives you then the information you need if an individual needs to switch plan types. So something to consider there that can make a big difference for you moving forward as to what you offer in those areas. So you've got some different things here that can be really, really effective. You can add those discounts later as to, the household discount, some of the other things that come into play. And then, of course, you got the flexibility of changing some of these different pieces that come into play. You get in there, all of a sudden, the 69-year-old lady is dip and chew, and in the matter of your appointment, well, it's no longer non-tobacco. So you can adjust these to properly field underwrite. And that's something that you have as well in here because you have health applications based on different conditions. So as you visit with your individual and you notice and you speak of the different health conditions they may have, well, there are some carriers, if somebody's diabetic, they don't want them at all. Other carriers will accept them. So how do we go through and determine what that might be with that differentiation? If that individual's got cardiovascular challenges, how does that affect rates and the individual's choice? So some different things that can come into play through the use of this tool. But then you'll see, remember, that piece that comes into play here, that's something you can provide your folks. They can read it. They can do the homework on it. If you establish this on some different things that I'm going to show you in just a little bit, they can even enroll themselves and you get credit for it. So we want to make certain that you're aware of all the marketing angles that can come in available as well. So as an agent contracted with us, you have access to that system through Medicare Center and the detail that comes with that as well. There are certain things that some folks may refer to as a MedSup that aren't, and it's important for us to note that. It's a big no-no to visit with an individual and speak of a Medicare Advantage plan as a Medicare supplement, because it's not. It's network-based, different world. Same thing with the PDP programs. Some folks don't know the difference between Medicare and Medicaid, much more common than you think. Medicaid's not a MedSup either. Different employer or union plans, they are a group coverage and they're not a MedSup either. The folks that have served our country and received benefits through TRICARE and VA, well, they're not MedSups either. Long-term care programs are not MedSup. They're a necessity in other areas that aren't covered by original Medicare. And then for some of the native population, the benefit packages they have, well, they're not MedSups either. We want to make certain, however, though, as we go through and we visit with people about their base coverages, which is what we're doing with an MA or a PD or and a Medicare Advantage plan, that they realize there are other programs they may need because of their choices. They MedSup, well, they need a PDP plan. They need a prescription drug coverage. Are they going to travel outside the United States? Medicare is not going to cover a claim abroad, generally, unless it's a special circumstance in Mexico and Canada in some circumstances. Does that MedSup program offer coverage outside the United States? Remember I said, well, gee, if Medicare doesn't pay, the MedSup won't over. This is the exception. Long and short-term care programs, some folks will assume Medicare covers that. That opens a different discussion with a different timetable. If you're doing just MedSup, you can do it that first time, but you're going to want to do some research with it. Hospital indemnity and critical illness programs, a lot of times we hear a lot of that as a needed coverage for MA plans. But if you look at some of the expenses that a person is subjected to in a hospital, a whole bunch of them were non-medical. And these are fee-for-service plans that pay in addition to any other coverage the individual has. And it can be crucial in maintaining their financial programs that they have set up simply by an additional, fairly inexpensive plan as well. Many folks that come into the Medicare supplement world too, they are folks that may have had a benefit package at work that provides dental coverage. Took me a while to say that. Having a DVH program, a dental vision and hearing program, is something that is a one more question close, one more question offering to an individual to make certain that they have the coverages that they need. We actually have a guide developed for you as well with Premier that can help you in these circumstances to deal with the advantages and the information that's needed on these different programs, and help design the case too when you're active in the Medicare supplement arena. Make certain that you ask your agent success manager, your marketer with Premier, to provide this document for you as well. One of the things too, I keep talking about, gee, John, all these other programs Medicare doesn't cover. Well, covering them not only takes care of that need that your prospecting clients has, but it also gives you the opportunity or the better chance of maintaining the coverages that you have in the household. The more plans you have in the house, the better your retention is going to be. They don't have to be with the same company. They have to be with the same agent. That's you. However, some of the carriers that are out there, if you're utilizing the carrier enrollment program, they may have ancillary benefits that you can add to in a very simple enrollment process by using that software as well. One of the things too that sometimes folks don't realize is how you're paid. Flat rates on Medicare Advantage and PDP programs, they are prorated as we go through the year. However, a MedSup, you're paid a specific percentage, and you can direct if there's an advance or an as-earned program. What you'll see in these programs is the commission is paid once the policy is in force, and that can make a difference for you when you are calculating your budgets. And that's the same way it is with all the different programs that are out there. We got to calculate what we do. This does also give you an opportunity to reach into the centers of influence within your community and offer information through presentations that are set up by CMS themselves. So we have these available for you, and it gives you then the opportunity to discuss Medicare supplements, live or virtually, depends on your circumstance. Setting up presentations within a faith-based community or a carrier's network where the doctor is looking at their payer mix and they only want so much here or so much here when it comes to who's paying the additional. But you also have docs out there that aren't part of a network, and they need help from you as an agent and providing this information with Medicare supplements and prescription drugs. We do have that program too that can help you if you are the enthusiast of a little exercise. This is a T65 locator that you download to your smartphone. They register you as they recognize you have a contract with us. It too is available to you without cost, and it gives you then the opportunity to pinpoint where these people are. So one of the things we do when we look to fill our T65 funnel, well, you got to plug it in with 64s and younger. Well, what happens for a 64 versus a 65-year-old outside of the obvious? Well, if you're talking about dental programs, it's a price increase. So it's a way to fill that funnel and go back and visit with them on other programs. And it gives you then, if you're stacking appointments in a particular area, one cancels, well, you can door knock for MedSubs. This will tell you where those folks are. This tool, I cannot underestimate or undervalue the value that it brings to you. It is available without cost to our contracted agents. It is the tool that contains that CSG pricing tool that I visited with you about just a moment ago. It does then give you the opportunity to quote multiple programs, do a side-by-side comparison. It gives you the opportunity to collect that scope and store it for that 10-year period through multiple means. It also helps you with the call recording that's been hoisted upon us and the storage of those calls as well right through the system. It gives you a microsite that you can utilize as a presence on the World Wide Web. It also gives you a contact management system that tells you with some different switcher tags which of your book of business may be more susceptible to a change. We want to make certain that the system helps you prioritize your calls and get you the maximum value of a client, not a one-year individual, someone who's with you for the long term. Lead Center we'll talk about in just a moment, but one of the things that's here too is resources through the Learning Center within the Medicare Center. So it has different talking points, scripts for working Medicare supplements, and that's part of the system. It is available as a mobile application, and to paraphrase one of those quasi-celebrities on television, it is free. Doesn't cost you anything as a contracted agent with our organization. It gives you then that opportunity to cross-sell through one of those components. As we saw on the website, and we did it live, you have different pieces that then can help you quote additional things too. You can come up with that review for the MedSubs. You can speak to the hospital indemnity programs to cover some of those non-medical expenses. And it also gives you an opportunity to speak to dental coverages as well. Multiple quoting on multiple lines of business through that piece. One of the neat things that comes with the CSG tool is a heat map. So if you're working a particular area, you can go in, designate information on an area, and it'll tell you what plan is being quoted the most in that area. That may be a means for you to say, hey, I need me some of that, or prep you for a discussion of the plans that you offer versus the one that you're running into. Really cool tool. It also gives you the opportunity as a plug-in to your website for an individual to go, in addition to that Pearl through Learning Center or through the Medicare Center, pardon me, it gives you an opportunity to have a presence on the web where people are going to shop the med sups that you offer. A great way to turn your website into a lead generation tool. That too is available without cost to our contracted agents. Some of the other things that we offer, why you want to do different Medicare supplements with our organization, electronic contracting process is part of the world nowadays. There's actually a couple of med sup carriers that don't want to take a paper app at all. So that's something that comes into play. We also want to give you the opportunity to create that agent profile. And if you're bringing on ancillary products such as dental, vision, hearing, cancer programs, critical illness programs, it's a great way for you to do that quickly and with a minimum of effort. We do offer discounted E&O to qualified agents. There's an emissions coverage for agents that contract with our organization for at least a carrier. But this is a program you own. You're not added to a blanket E&O policy, and it covers you regardless of whom you contract through for different insurance programs. Premier is huge. We're everywhere in the country. We have a broad portfolio. We don't offer everything everywhere. I don't know of anyone that does. This, however, is going to cover that requirement that insurance companies have when you do a contracting process. We also want to make certain that your license stays in place. We have discounted continuing education bundles through our association with WebCE. And as an independent agent, you have an opportunity to take out a modified guaranteed disability income program on yourself, on which you're paid a commission. So you're protecting your ability to earn. I mentioned that today's presentation is being recorded, now running a little long, my apologies, but they are made available on our website and on our YouTube channel. Past presentations are as well. So if you're looking to approach the faith-based community and offer explanations of Medicare supplement plans through that venue, well, we got some hints and tips that'll help you there. Some hints and tips to help you when you discuss life with providers. So a number of different things that come into play. If you're looking for a specific carrier and an explanation of their Medicare supplement plans, that may well be in that video library as well. We want to make certain that we talk to and make you aware of the fact that the Medicare Center program is a whole bunch of different things for you for multiple programs. And we want to make certain that you access that as a contracted agent, become comfortable with it, because it can make a world of a difference to you. I mentioned that MA programs have a flat, generally a flat commission piece that comes with it. The Medicare supplement plans, however, in many cases will have different marketing incentives for you that can pay you additional dollars. So we have a page on our website that lists that for you. And in many cases, those will help you qualify for carrier trips as well, and help you qualify for premier incentive programs that include the return of our producers convention that had been on hiatus because of the pandemic. A great way for you to garner additional compensation, in a manner of speaking, for your selling efforts. We want to put you in front of folks for through a number of different reasons or areas, and that includes, if you're cold calling, we can help you with lists, butt them up against do not call. Costs will vary depending upon your contracting arrangement with us, but also making certain that we help you with those community-based programs, grassroots programs, whatever you want to call them, how you can take a Medicare supplement program and make it part of your marketing philosophy moving forward. Some of the carriers have a unique way of supporting you through prospects. A couple of them have a really cool way of, as you produce, it puts money into a marketing budget for you, basically. So some different things that can come into play, and that may well be one of the indicators that you look for when you partner with different carriers. How are they taking care of me in those circumstances, and how are they supporting me with systems to make working with that carrier as simple as possible. Other pieces, let's talk about them in just a moment with different lead programs. Direct mail, based on production, drives down the cost, so you can do it consistently. You can qualify two different ways, through health programs that include med sups and through final expense. So you can run a lot of mail and do it consistently. And that's the secret to direct mail, doing it consistently. It's like an exercise program. You do it once, you might feel good about yourself. You don't see a lot of results. You do it consistently, that's where you see the benefits of participation. And we do so through preferred lead vendors because we vet them. We want to make certain that their systems can deliver upon their returns as quickly as possible, and that they are utilizing compliant correspondence to generate those leads as well. You also have an opportunity to use direct mail leads through a different program that are already set. You're not controlling an entire program, but you're buying returns. And these will vary from market to market, time of year, part of the world that you're in, but it's a great way to fill your calendar in with folks that have raised their hands and are looking for coverages that you may offer. The internet lead programs, we work with the prime carrier or the prime vendor in that world, and that's Facebook. And we have a program here that does it for both final expense and Medicare. It's important to note that if you're doing internet leads, particularly Facebook leads, you can get leads really quickly, but they want information really quickly as well. So you really got to stay on top of them, even if they're generated by a new program that we have that utilizes search engine optimization and defines those leads to a great deal for you as well. The cost of these programs, well, that's all available to you through your marketer with Premier as well. One of the things that comes as part of Medicare Center is the Lead Center program, and these are programs that you can set up based on your budget, how many you want at what time, and how they're delivered. What do I mean by that? Well, you can do a live transfer on it, or it can be kicked into your CRM for you to work that way as well. It's a great way for you to make certain that you are set up for success by having qualified people to speak to. Right through the system, all in that CRM, gives you the ability to work them quickly and efficiently. T65 locator already talked about. Referral programs. Well, a lot of times when we visit with individuals about the options that they have, we want to take that one lead and make it effectively a lead source for us throughout the sales process, even if they buy or if they don't. But it's also a way for us to go back to our book of business and say, hey, I got a great dental program that's come available. Do you know of people in your area that could use the help? You're not asking them out front, but generally they're going to raise their hand and say, hey, give me some of that. It's a great way to make certain that you stay in touch with your book of business as well. We do all this because we want your business. We want to be referable to you, to your friends in the industry as well, and give you the opportunity to start this as quickly as possible. You got contracts in play right now? Well, use the tools that we discussed today and make it part of your marketing plan. It can make a opportunity of visiting with folks much easier because you're offering that complimentary Medicare supplement review to help them get the biggest bang for their buck when it comes to med subs. And you can put it in play very, very quickly. So I want to make certain I have all the questions covered. Yeah, looks like I do. At this point in time, this is thank you time. For those of you that are contracted with Premier and have done business with us in the past, I thank you for that business. I look for a deepening of that relationship through some of the programs like what we discussed today with the different Medicare supplement plans that are available to you through our organization. If you haven't done business with Premier and you're listening and watching this program, thank you for the opportunity to visit with you about the possibilities. We look forward to being a partner with you in the very near future. But for everybody that's watching this program, I want to thank you for the investment of your most valuable resource, and that's your time. Gone a little long, a lot of information coming to you. I really appreciate the fact that you are listening to this program and perhaps garnering a tip or two that can make you more effective in your chosen profession. So at this point in time, what I would like to do is thank you once again and wish you a good selling until we're able to speak again. We look forward to that visit in the near future. Watch our calendar for additional trainings as well. Thanks so much. We'll talk to you soon.